Hi everyone, my name is Jasleen Pena, and this is my presentation on the health and illness in Hispanic culture. I am very excited to share this presentation with you guys because I am Hispanic myself. My dad is Honduran and my mom is Mexican. So I was very excited to choose this topic and do more research on my own culture. So, starting off with the learning objectives, the first thing that we're going to go over in this presentation is the culture and history of the Hispanic community and including some major milestones. We'll next dive into how the Hispanic community deals with health and illnesses, and then how to provide culturally competent care to this culture. As with any culture, it is important to do research and see what each culture, I guess, participates in or goes through, believes in to provide great care for them. Okay, so starting off with some history of the Hispanic culture. In 1513, the Spanish explorer Juan Ponce de Leon, I'm hoping I'm pronouncing that correctly, came along the Florida coast and claimed territory in the name of the Spanish crown. He came looking for the Fountain of Youth, which he did not find, but he returned to this territory back in later in 1521. And when he got there, he was forced to retreat to Cuba, where he then passed away. That is the very beginning of the Hispanic community, the very beginning of like Hispanic history in the US specifically. But moving on to 1821, Mexico gained gained independence from Spain, which was established by the Treaty of Cordoba. And then in moving on to 1943, racial tensions started to rise between Hispanic and white communities. Young Hispanic people started to be mistreated, but in 1964, President Lyndon B. Johnson signed the Civil Rights Act forbidding discrimination based on race, gender, religion, color, and national origin. And this also helped establish equal employment opportunities. Okay, moving on to the next slide. When it comes to defining illness, Hispanics will sometimes lean more to traditional healing methods and medicines that pass down through generations. For example, one thing that popped in my head, in my family, we use Vicks Vapor Rub when we're sick. We will put it on our throats and under our noses and sometimes like in our nostrils to help relieve some of the sickness. We believe that it's helped, but this has been passed down through generations, again, in my own family. But some people may prefer home medicines or contact a curandero, which is also known as a folk healer. And then lastly, many Hispanics are religious, mainly Catholic, and their belief about health and illness might be influenced by their beliefs, or they might rely on their faith to save them from their sickness. All right, so the U.S. healthcare system is a mixed system. You got we have public, private, and government insurance. For example, we have something called Medicare and Medicaid. Medicare is for people over the age of 65 and for people who have a disability, while Medicaid is for families with low income. And then health insurance is sometimes offered through employment. For example, I work with Starbucks and they provide health insurance for employees. So, but the requirement is we have to work 20 hours a week or more so that we can qualify for it. And then anywhere from $10 to 50, or sorry, let me reword this. It can range anywhere from $10 every paycheck to $50 every paycheck. Just depends on what health insurance you want, but that's about how much you will pay um, each time. And it's really great that they provide this because if you're looking on your own for health insurance, it can cost, again, probably like 100 to 800. I've heard many different amounts of numbers that people pay for their health insurance. So, healthcare resources and practices in the Hispanic culture. So, Mexico has a social insurance system coordinated by the Federal Ministry of Health. Their model is mostly government based with a little option to deviate from government health plans. With little option to deviate from government health plans, each plan develops its own set of rules, hospitals, and doctors. In Mexico, this is not the case. Every hospital is affiliated with a single insurance plan, and only members have access to care there. In Latin America, even, oh, sorry, that was all for Mexico. But in Latin America, even if some are covered by other public or private systems, a vast majority are still excluded for financial and geographical or cultural reasons. And then, according to research, an estimated 121 million people are too poor to afford healthcare, and another 107 million do not have access to healthcare because they reside in rural places. Sorry, trying to go to the next slide. Oops. Sorry. Okay. So, for health concerns and circumstances, there are several issues that are more prevalent in this community than others, such as obesity. Obesity is a major concern for Hispanics. According to research, Hispanic Americans are 1.2 times as likely than white people to be obese. Um, Obesity most of the time comes with other health issues like diabetes, coronary heart disease, strokes, high blood pressure, and more. And speaking of diabetes, that is the second most common disease for the Hispanic community, and it is anticipated that more than half of Hispanics will be diagnosed with it at some point in their lives. Uh, and if some of you guys don't know the difference in type 1 and type 2 diabetes, the main difference is type 1 is an sorry about that, autoimmune condition, and it is where your body cannot make any insulin at all, while type 2 diabetes is not an autoimmune condition, but it is where your body isn't making enough insulin, and this can be due to physical inactivity or obesity. So, moving on to behaviors and beliefs, because some people have moved from their home country to a new country. For example, a lot of people from Mexico or like my dad from Honduras moved to the US searching for new opportunities and to provide like a new life for the family. So, because many people have done that, um, their routines in real life can be changed and be so different from what they're used to. And this can contribute to the problem of lack of inexpensive quality of food, like packaged and frozen food, um, and also just limited healthcare information. The most common foods in the Hispanic community are high in sugar and carbohydrates, which in correct proportions is really good for you, but when it takes up the majority of your diet, it can be very bad for your body. This can be a contributing factor to the rise in obesity and diabetes. So, socioculture factors. One quote that I pulled from a website, it is in my reference page, but it says that in their home country, some had a daily walk to the market to pick up their food for the day. Now, they may be working so many hours that they don't have time to go for walks, or they may be renting a room but not have access to a kitchen. The result is that many rely on packaged and fast foods. This routine in real life can be passed down the family. Okay, so as mentioned before, the Hispanic community has been experiencing rapid growth in obesity, which is caused by many factors. Some of those are due to, of course, genetics, but also due to limited availability of affordable, healthy food, inadequate access to safe exercise slash like play areas like playgrounds and maybe public pools. Having access to these things is so important because if you don't have access to these, it can be very difficult to get physical activity in for you and your family. Um, if a family lives in a neighborhood with no public park or a safe park or a public pool, it's very hard to show your kids um, how to get physical activity in and how important it is for you and your mental health. Um, As for healthy foods, almost everybody knows that to eat healthy, it might cost a little bit more money, and some families might not have the ability to do that. So it can be very hard to provide for themselves and their family. Oops. So to bring, oh my God, I'm so sorry. Okay, so to bring up my hypothetical character, I came up with a 28-year-old Mexican woman who has been recently diagnosed with fatty liver disease. This is a very common disease in the Hispanic community. She comes from a large Catholic family, two sisters, three brothers, and she lives with her parents. Her mother also has fatty liver disease, and now she has it as well. Very young to have it. She is the oldest of her siblings and the only one who has been diagnosed with fatty liver disease so far. So, that is a person I came up with, but to provide culturally like competent care for her, it is important to be understanding of her beliefs and values, be mindful of the cultural and religious views that may influence their healthcare decisions. So if the doctor were to learn about about the patient's like preferences and engage with them in friendly communication and just honestly like listen to the woman's concerns, it can be very beneficial to her, um, and help the healthcare provider learn as well, and in the future be better with people in the Hispanic community as well. So you can learn that. I think I said in the beginning of the presentation, many Hispanics are Catholic. So if you just learn a little bit about like Catholicism, such as like attending Mass, is very important to them. Engaging in sacraments and honoring holy days are all examples of Catholic religious practices that one could be aware of and respect. Um, so sorry, I was supposed to take that last part out, but sometimes hospitals will have a church or prayer section in the hospital that people could go to. So if the doctor were to refer them to that area, that could be so helpful to the family. And then again, with the culturally competent healthcare, um, it is very beneficial to know some of the background. For instance, majority of the people speak Spanish and sometimes only know Spanish. So if the healthcare provider doesn't have to be fluent in that language, but to provide great care, if the healthcare provider can make sure that an interpreter is there to help translate to this family to help them understand what is going on. But if the provider also learned a couple Spanish words themselves, it could show that the healthcare provider really cares for them and wants to help them as much as possible. And the family will feel like they're being taken care of and respected. And then from the example in the slide before, although the daughter has her mom as support for also having fatty liver disease, it is important for the provider to listen to all of her concerns and questions that she may have. Since she is the oldest daughter, she probably has a lot of responsibility for helping around the house and taking care of her siblings. And so, as a healthcare provider, I would recommend to her and her mom to now ask like the family members, such as the dad and the siblings, for more help around the house and give them ideas of what the daughter and mother could do together um, to help them just fight against this fatty liver disease, such as like they could work out together, they could maybe come together and come up with some healthy meal ideas. So those are just some examples that I came up with. And it is also important to cut out alcohol from your diet when struggling with this. That is the end of my presentation, and here are my references. I have 2 pages of references.